Together we achieve victory over heart failure.
Hello everyone, I am Dr. Sumit Shankar, and today I'll be delivering a small talk regarding heart failure. So in India, the majority of patients grappling with heart failure are surprisingly young individuals, whereas in Western counterparts, the heart failure is basically seen in elderly. So actually, what is heart failure? We can divide it in 5 essential insights. So first thing is, what is heart failure? When a doctor tells you that you have heart failure, patient thinks that it is the end of their life. No, it does not mean that. It just means that the heart is unable to pump the blood or effectively receive the blood. That is, there is difficulty in pumping where the ejection fraction of the heart, which is normally around 50 to 70%, goes down. So which can be categorized into mild, moderate, severe, or there are various stages of heart failure, 1, 2, 3, 4 stages ABC. So that is not important. The thing is that heart failure effectively means that it is unable to pump the blood, where the ejection fraction has gone down to less than 50%. That is heart failure with reduced ejection fraction, or heart failure with preserved ejection fraction, where the heart is unable to receive the blood. So that is one thing. Second thing is, why are Indians more affected with heart failure? So that has got predictability because of diabetes, hypertension, obesity, and smoking. These are the 4 major factors which affects Indians the most. Then what are the symptoms you can look for? The most common symptom of heart failure is shortness of breath, where you have difficulty in breathing initially while doing strenuous exercises, gradually coming down to even routine activity becomes breathless, and at last, they become breathless even at rest. So that is one thing. Second thing, there can be palpitation. Palpitation means you will have awareness of your own heartbeat. That is, you can feel your heartbeat pumping very fast or pumping slow, or a feeling of skipped beats. Then there can be generalized weakness, loss of appetite, vomiting, fatigue, confusions. So that is point 3. So what is heart failure? Now you have understood why it affects the Indians. You have understood now. The third thing is, what are the symptoms? So what can you do to protect yourself? So to protect yourself, the most important thing is early detection. So how will you detect? So you can get detected through routine blood tests, through imaging, that is echocardiography, or routine tests like ECG. Then what you need to do once you have developed heart failure? The first and foremost thing is consult a cardiologist who is qualified to deal in heart failure. Second thing is, take medications properly. Third thing is, avoid smoking, tobacco, or alcohol totally. And heart failure does not mean you have to be bedridden. Initial stages of heart failure can very well be reversed. Maintain a proper dietary advice, maintain a proper healthy lifestyle, do exercise regularly, and as I already told, quit alcohol and smoking. And lastly, and most importantly, is keep your blood sugars and blood pressure under control. And coming to the last point, that is, how can the doctors help you? If the patient, even after medical therapy, that is, after giving treatment, they do not improve, then comes the role of devices, where even in the last stage of heart failure, we can put something known as CRT, that is life to heart failure patients. Thank you very much.